It's impossible. It's amazing. It's a miracle. I don't know. There are no words to adequately describe what we've seen, what we've learned, what we understand now. And I think the idea of what this trial means to the future trajectory of injuries such as this it's just the beginning. So heavy. So today is an exciting day because we're finally going to talk about a clinical protocol we did for spinal cord injury. Ta-da! If you look at the sheer amount of work, you would say, wow, that must have been for a lot of patients. But no, today's case is for a single patient. So all of this data is pertaining to only one person, a very important person. Let me introduce you to Tin.
My name is Tin. I am a C5, C6 quadriplegic. I have arm function, limited hand function, and of course I can't use my legs.
My name is Crystal Wynn. I am Tin's wife. We've been married for 18 years this Saturday. We were in the Keys for a friend's wedding. We didn't make it to the wedding, but we were at I guess it was considered a sandbar because the ground was about waist deep. But I just remember, looking at him about to jump into the water, and just maybe even 30 seconds later, it felt like I just see his friends pulling him out of the water. The ambulance came and, got him on the stretcher and said that they would have to care flight him to Miami, which was about 2 hours from where we were.
2 hour drive.
2-hour drive. I was not able to get on the helicopter with him, so we had to literally just jump in the car and just start driving to try to meet them at the hospital. Once when we got to the hospital, they made it seem like everything was fine. Like they said he was talking, he was answering all the questions, and so I really wasn't aware of how severe the situation was.
He had jumped off a boat and hit his head and had an injury at the C5, C6 location, leaving him an incomplete quadriplegic.
I don't think like I said, I didn't really understand the degree of his injury until they handed me a folder with Christopher Reeves on the cover. And so that's when it kind of sank in. It was several hours until I got to see him, but he had tubes. Like he had a breathing tube, but he couldn't move, he couldn't talk.
Had the halo on.
He had a halo on. We had to get a care flight to come back. It was about $22,000, I believe. Insurance wouldn't cover that. He went through hypothermia. That was about, 2 days. And then had to get him stable enough to be able to get the breathing tube out to see if he would be stable enough for that. He was fighting pneumonia, and so it was just one thing after another. So, it took time.
How did we meet Tin? Spinal cord injury was never a condition that we were actively studying. As many of you know, Hope Biosciences works on the production of stem cells, and we were really at the point where we were perfecting our technology. But one of our employees had a family member that suffered a terrible spinal cord injury. They had just given birth to their second child, so you had young kids in the house, and for this family, it was just devastating. The process started by taking about a tablespoon of fat. From that 1 tablespoon of fat, we isolated mesenchymal stem cells, which are responsible for regenerating into practically any cell type that the body needs. So in Tin's case, if we needed to rebuild muscle, it could do that. If it needed to turn into new bone, if it needed to turn into new nerves, it could do all those things. So the environment typically signals or tells that cell what to become. So it's an amazing tool for regeneration. We isolated the amount that we could get from that small amount of fat, and then we would begin the culture process. We cultured the cells to hundreds and hundreds of millions to billions of cells. And once we stored them for future use, we're able to take them out of the tank and remake them whenever the patient needs it, to be delivered on that day fresh. So they're not frozen. They've been thawed out, recultured, prepared for injection, and delivered back to the patient. Intravenous delivery seems rather nonsensical, if you will, because if you have a spinal cord injury that's localized, in this case, right here, why would you give stem cells intravenously? Well, we know that through animal studies, we know that approximately 10% of cells will actually make it to that injured site. Now, that depends on a lot of factors. How close was the injury to the time of the administration of the drug? How severe was it? There's a lot of different factors, so we can't determine that perfectly. And of course, we don't measure that in a human, but we wanted to take the less invasive approach. We wanted to be able to deliver cells in a natural way, give it in his bloodstream, and allow the body to send the cells to where they needed to go. And in spinal cord injury patients, there's a lot of issues. The more that injury might just be one injury, but then over time, there are other complications, right? You start not using your muscles, then you have muscular atrophy, you can have pain, you have spasms, like a lot of things come along with spinal cord injury that are sort of secondary to the injury. And so we thought, okay, well, cells could probably help with a lot of these things, not just the injured site. So that was the whole logic behind creating an intravenous application. This is the first time that we are aware of any person getting this many cells over this course of time. He received 200 million cells every other week for 10 times, which equated to 2 billion cells. By the end of 2019, we started infusions. The whole protocol was 10 infusions over the course of a year. We would do bi-weekly infusions and then check his progress at the end. Progress measurements included, obviously, quality of life changes, changes in his mobility, and also we were conducting EMG testing. That's an electromyogram that simplistically measures nerve conductivity between signals coming from the brain to the extremities. Of course, at this point, Tin had been static. His progress had been static. Everything he was able to regain, and typically after a spinal cord injury, you're able to regain a certain amount of function until they say that your injury is essentially permanent. Everything that going forward is going to be the same and static. So by this point, physical therapy was cut off. Insurance companies will stop paying for physical therapy because spinal cord injury patients at a certain point can no longer move. So there's no point in exercising those muscles, which is why they cut it off. So he was in that situation. What we really wanted to see was, would the stem cells go in and actually rebuild and repair the injured site? Would they go in and repair nerves and possibly change the inflammation in the body? We wanted to check all these different things. So after 2 billion cells, after that first protocol was finished, it's amazing. He's moving. He has almost complete upper body control. He's driving a car again.
So most of the doctors will say, it's still early on research. and most of them are happy that I'm trying things, but they always tell me, you can't put too much into it, like, too much hope into it, but do it because you never know. Because since the whole thing with stem cells is still very young, there's always a possibility you need a lot of help.
My name is David Gonzalez, and I am the clinical team lead here at Hope Biosciences. About midway through Ten's protocol, COVID hit, and we had to develop a solution for him to continue to receive his infusions. The important part is that we want the patient to continue to get their treatment without any sort of lapse or deviation from the protocol. We petitioned the FDA to continue Ten's infusions remotely so he could continue to receive his treatments at home. To the best of our knowledge, this is the first time FDA has approved such a request. Specifically for spinal cord injury patients, this has changed the landscape. I think that this opens up a whole new world of possibilities for them.
Well, I personally have had quite a lot of experience with the stem cells abroad, mainly for multiple sclerosis. Small numbers, but dramatic results at times. So my hope is not simply based on wishful thinking. I really have seen patients improve, and I'm a believer that is the future of medicine. In this particular case, hopefully we will achieve a good result. He himself, his personality is also very reassuring because he's hopeful too.
Now, by the last year of treatments, we got 12 treatments to go, we knew that standard cell therapy like this wasn't going to physically get him out of the chair. He actually had to get himself out of the chair. And if you think about how difficult that is when your mind is telling you you can't do something, even if your nerves are theoretically repaired, until you fire off those signals, nothing's going to happen. The cells aren't going to get you out of that chair. So it was at that point where we had sort of an aha moment, and we really heavily encouraged this patient to go and get physical therapy.
You don't spend a lot of time with me at the gym anyways. So what she knows is very limited. She just knows there's cute girls there.
Well,
My main trainer is named Crystal too.
it is. Well, Tim started going to React when insurance wasn't covering the regular rehab. So it was something that we wanted to continue rehab for him. He goes, twice a week. You had a lot of great things to say about it because it was a different type of workout that you would get versus what you had gotten at Baylor Rehab. I guess they're a little bit more aggressive, that really worked on your core, and I was only able to go with him for one session, or probably a couple sessions.
2 or 3 sessions.
And it makes me proud of how far he's come, because I know a lot of times he gets disappointed because he feels like he could have done, he should be a lot further along, but you have to be grateful for, what you have. When we look back to from the day of his accident, or even last year, like, he's come so far. It's hard to see like the minor progressions, but when you look back to, a few months back or a year back, or from the very beginning, like, he's fully independent now. Like, I don't even have to worry about him.
He's able to go fish, something that he, something that was such a dear hobby to him, that the loss of that caused a lot of depression. As we started to see Tin's progress, it was evident that he was clearly doing things that he should not be able to do, and that improved. The more he went to therapy, the more he would improve. The more we gave cells, the more he was able to continue doing more. He's pushing his body, we were pushing the cells, everything was happening concurrently. And that's what we learned from this, that those two practices need to go hand in hand. We can do the rebuilding part, but the patient has to do the moving part, and that together, that synergistic effect is what really made an impact in this case.
Today I sat in and was very impressed. First of all, he was unable to move his arms as well as he has now, and he is developing a great deal of sensory return, and hopefully my friend Barani would tell you about the changes that we see in the electromyogram.
Electrophysiological studies that show much better improvement as far as the peripheral nervous system. Distal latencies are much faster, velocities are much better than before we did. I saw better amplitudes in every single motor and sensory nerves. We're going to analyze it and compare it to the previous study to see if there is any better improvement, which obviously there is. I saw much better.
Yeah, I was gratified. Apparently he was, when it happened, he had no movement at all in his arms. And then he started developing some movement in his left and on his right arm. But now he's quite capable of moving right higher than his, shoulder levels right up over his head. He still has problem with fine finger movements of both hands, but hopefully will return in time with physiotherapy and exercise. Yeah, I think he's more paraplegic now rather than quadriplegic.
I always have to be mindful of what I order because it can't be too tough to eat and stuff like that. And I get very short whenever things don't go right. So it's kind of like if I go to Roadhouse and I want a steak, it's like of course I'm gonna want to try and cut it myself, but just holding the knife is hard. You don't really have a tight grip of it. So yeah, I mean, the original interview talked about what I wanted to do, and I said that I wanted to be able to cut a steak at Texas Roadhouse by myself. I like to cook my own steaks now, so I smoke a lot of different meats and stuff like that. And just today we smoked a steak, then I grilled it, and then I cut it up, and then we had lunch. So I mean, my abilities to do things, my hand dexterity is a lot better. We're working on stand workouts, so I'm able to do a lot of things that I never thought I'd be able to do or were very hopeful that I could do. So I feel like I'm breaking a lot of the goals that I had set for myself years ago.
So Tin comes in for his last infusion. It's April 6, 2022. He comes in for his last infusion, and we built quite a relationship. We've been with him for 3 years, and he does some showing off, and he grabs onto sides of chairs, and it was the first time we saw Tin get up from his chair by himself. And for us, that was a wrap. We knew at that point that we did what we could, and we just hoped that the patient would continue his progress, and sure enough, he did. So after watching all this, if you feel inspired, you feel that the work that we are doing is important, please share it. Share it. Donate to the cause. Help us do more.